Now, Dr. Max, I understand that there's a high rates of autoimmune diseases among women now. How long does it usually take? Let's just say thyroid for a
hmm
minute. How long does it take to heal a leaky gut or inflammation that's causing thyroid dilemmas in women?
It ranges from person to person, depending. A lot of it can't be predicted, but someone might just have parasitic infection and nothing else shows up. They're fine with heavy metals. They're fine with bacteria. They're already on a clean diet, and so okay, let's just take care of this parasitic infection, and let's give you things in order to restore your gut microbiota and heal the lining of the gut. That might not take very much time. But some people, they have a lot of things that show up,
Hmm.
and not everything can be attacked at once because your ability to heal also requires energy. And so if you throw a ton of things at someone and they may not actually have the constitution to heal and utilize everything you're throwing at them, and then there's the risk of saying, okay, well, this doesn't work. I don't know what to do. So you really have to decide, okay, what do I want to attack first? What are the phases that I want to go through? But I would say, on average, when people work with me, I say, give me 6 months.
Hmm.
In 6 months, either I can get you better, or I'll know exactly how much more time it's going to take, or I'll know if I cannot, and if I need to refer you out to someone else who does something that I'm not as good at. But 6 months is really a good amount of time. And some people, it takes as little as 3 months.
And what are some of the results that you get from women? Let's just say, again, going back to thyroid, because this
Mhm.
is this is huge,
Yeah.
and so many women are in this, and men too. I don't want to,
Mhm.
just keep it on women, but like, do you, when you detox the body and everything is okay, do they feel a difference? Is this truly curable without medicine?
Well, I don't like to use the word cure because there is no cure, but it's all about reducing the need for expression.
There's no cure for thyroid.
Well, you can take medication to manage the
Hmm.
expression of autoimmunity, but your body will always be coded. The blueprint will be there to
Mm,
produce the antigens in autoimmune disease. But can we remove the reasons why the expression or production of antibodies exist? And that comes back to inflammation. What's the cause of inflammation? Toxins, infections, and emotional stress. So you can either take the drug to artificially suppress the immune system so that the thyroid doesn't get attacked, or you can actually try to address the root causes. But to answer your question, all kinds of things get better in people. They come in with a primary complaint. They can live with the second, the third, and the fourth, the fifth, and the 10th, and the 11th. Okay, they're there. But what they find is that a lot of things get better, things that they didn't even originally come to see me for,
mhm.
because that's just how health works. It is a systems based approach. It doesn't just work where one thing is getting better at a time, unless you go the pharmaceutical, Western type route. Then you really are, it is one symptom
Right.
at a time.